Good morning. My name is Rob, and I've been blogging about obesity-related issues, sharing recipes, and more on my website for a number of years now. I am a volunteer and board member with the Obesity Action Coalition. I am also a bariatric surgery patient. I am nearly 11 years post-op Roux-en-Y. At my heaviest, I was around 380 pounds. My lowest after surgery was about half that before I settled in at around 225 for a few years. Then I slowly started gaining and have been maintaining at around 270 for the last few years. I have a long history of not really discussing my weight with my doctors, but it's something that was always there. I have memories of attending Weight Watchers with my mom at one point around grade 5 or so, and then again during grade 11. I don't recall how I came to do so, if it was my mom's idea or my doctor. I do recall, though, in high school, sneaking treats while I was at school and being afraid that it would all be revealed at my weigh-in. And then there was that relief at having lost a pound or two instead of gaining, as I was sure I might have done. I was on medication for hypertension starting in my early 20s. While I'm sure my weight, which was near 300 at the time, was mentioned, it was never done so in a way that had any sort of lasting impact on me, positive or negative. While many with obesity will tell tales of how their doctors belittled them for their weight, I really have no such memories. And maybe that's just as bad, or maybe even worse. My providers, to my recollection, were almost apathetic about my weight. Maybe a mention here and there about how losing weight would help with my blood pressure or my knee pain, but really never any inquiries about what they might do for me or have to offer for assistance. It may have been stubbornness or embarrassment, or likely a mix, that I never really wanted to bring it up myself. I would tell myself that I know what I needed to do, I just wasn't doing it. I was aware of bariatric surgery, but I was convinced that I didn't need the help, certainly not that of surgery. I just needed the will. I would go on different diets, lose the weight, and joke about how it would find me again. Then, of course, it would come back and bring friends. The last major weight loss I had before surgery was during a bout of depression after a failed relationship. I had been hovering around 350. With this, I got about as close to 300 as I'd been in years. But again, that weight came back and more, pushing to my highest weight ever. Finally, I figured out I needed help. I looked more into surgery and decided that was the way I needed to go. I approached my primary care physician, and he was very supportive of the decision. He referred me to the center where I would eventually go on to have my surgery. While I'll be eternally grateful for his support, because we all know patients who have had doctors actively try to deter them from such treatment, I did get a little confused. I found out from his nurse that she was a bariatric post-op, and so he was aware of it as an option. I've always wondered, and unfortunately never got the chance to ask him, why, if he knew that bariatric surgery was a viable treatment, that he never brought it up with me. So there's this common theme among those who have had bariatric surgery when asked if they have any regrets. They'll often answer, my only regret is not having done this sooner. I would usually counter that with that I just don't know if I would have had the success that I did if I had done this any sooner than I did. But as I've continued to reflect on it, I really can't help but wonder. I came to this decision on my own after walking an often lonely path. What if my doctors had asked me years earlier if I would like to have a discussion about my weight? I'm sure I would have been resistant at first, but if I had been reassured earlier that I didn't have to do this alone, that I had options that could help, who knows? At the time I had my surgery, there was still this mentality that surgery was somehow a last resort. While on a professional level you may have been viewing obesity as a disease for quite a while, the public wasn't there yet. And even those who had surgery often looked at this as a cure and that the weight loss was something that their surgeon gave them. Though I think it did start changing quickly in the time after I had my surgery. There has been this shift in how surgery is viewed as being this fix for obesity towards being just one option as a treatment for a chronic condition. I realize we're here to primarily discuss regain and non-responders, but I think when it comes to seeking help, there are similarities to the initial decision to seek treatment. I think I can summarize what a lot of patients feel when it comes to their obesity and treating it in a single word. Fear. There are fears just interacting with those around you on a daily basis. We're shamed in the media. We're looked down upon in public. There's the looks you get when the only seat left on a bus or a plane is the one next to you. The fear you feel about real and perceived judgments when you go out to eat. The fear you have over the possibility of not finding a really nice outfit for that upcoming special event. When you're dealing with obesity, you fear simply going to the doctor because of all those times when you were shamed over your weight, Or your reason for being there was just glossed over in favor of another admonishment or lecture on how you just need to eat less, move more. You come to the decision to have bariatric surgery to treat your obesity, and you're faced with new fears. Fears about having surgery, the proverbial rearranging of your insides. There's the complications you hear so much about in the various online forums, from dumping to the foamies, or worse things such as blood clots or leaks. The fear of food itself. Food is very much a part of our socializing and celebrating. So now there's the fear of never eating some of the foods we enjoy the most, the foods we use to bond with loved ones. Or should we choose to make changes around those foods and situations, there's the fear of what others will say to us, think of us, the pressure they may put on us. The stigma surrounding not just our obesity, but our attempts to treat it at a whole new level of pressure and fear. The pressure comes in many forms, causing fears over the reactions we get from loved ones and strangers alike, simply because we want to take steps towards improving our health. There's the looks in the gym as we struggle to do even a couple of minutes on the elliptical, apathy, outright disdain, and the demeaning photos that find their way to social media along with the hateful comments. We took the easy way out, is what they'll say. It takes a lot of mental and emotional strength to rebuff these things time and time again. And even if those things don't scare you, there's that lingering fear in the back of your mind. What if it doesn't work? What if I'm the one this doesn't work for? What if I lose weight and, like so many times before, I just gain it back? What if I'm a failure? We're told from the beginning some regain is not unusual. For many, they're told to expect it. I personally lost a lot of muscle mass, so I not only expected it, I wanted it. I regained about 30 pounds of muscle mass from my lowest weight. A couple of years after surgery, I became unemployed, and with it, I lost my insurance. I ended up working 3 different part-time jobs to try and make ends meet. This left little time for my favorite form of activity at the time, biking. Life happened, and with it, my weight started to go up. Would it keep going up had I lost the drive, the determination I had maintained the first few years after surgery? I will say this, I feel that I was truly fortunate to have been referred to the surgical center I was. The entire staff there was knowledgeable, understanding, caring, and I'm actually still friends with some of them to this day. I was able to visit with a nurse for free as part of my surgeon's program, but aside from trying to make an appointment and working 60 plus hours a week, I still had that fear of failure, of what they would think of me if I truly let how I was feeling about myself be known to them. And honestly, there was a bit of fear of, letting them down. For many others, it's more of a fear of being judged, being told they screwed up. About 5 years ago now, I moved from Minnesota to Washington State. A couple of years passed, and despite having gotten much more active again, hiking now instead of biking, my weight stayed pretty stable. I have managed to remain in about 10-pound range for over 5 years at this point. Yet there's this underlying fear that remains that my weight will creep up again at any moment. Intellectually, I'm able to argue that we should not focus on that little bit we may have gained, but instead shine the light on what we've kept off. Yet every so often, that feeling of fear, the fear of gaining even more, finds a way to step back into that light. Over the years, I've attended information sessions held by a number of programs across the country, and often the topic of regain is brought up by those looking into surgery. There's some surgeons, though, out there that will outright say that if a patient experiences regain, it's because they're doing something they shouldn't. I'm sure you'll hear a lot more about this throughout the rest of the day, but it's not that simple. And even if this was true, if someone hears this from the first time they meet a surgeon, it can very much feed into those fears, especially those of failure and judgment. I know I can't speak for anyone but myself, but I've heard so much of this echoed by others that I feel pretty confident saying I'm not alone in these feelings. As I was putting this together, I was struggling with how to wrap things up, what sort of takeaway I could provide. So I decided to reach out to others via an online forum and just see what they had to say. I asked, if you were to experience regain again, how would you want your healthcare provider to address it with you? There were 4 key things I feel came out of the discussions we had. Be there, ask how I feel, listen to me, and don't judge. As far as being there, too many stories of providers not following up with a patient were shared. Centers that had no sort of support program, maybe they stopped reaching out with reminders, or even were just unhelpful, even dismissive when a patient did reach out for help. Yes, we as patients need to be responsible, but sometimes we need a nudge or a reminder. More importantly, we need to know we're welcome unconditionally. Ask how I feel. Ask how I feel about my current weight, my situation, etc. I know for me, I was often reluctant to bring it up because of that fear, that embarrassment. I may even be trying just not to think about it. Someone simply caring enough to ask me may be all I need to encourage me to take that next step. And then listen to me. Hopefully by listening, my provider is going to help me. Maybe not directly, maybe by referring me to the next best resource, a dietitian, therapist, exercise specialist. Maybe I'm not ready to discuss my weight at this time, or maybe I'm there for something totally unrelated to my weight, and I just need help in finding a way to address what else is going on. Those problems may be more important to me than my weight right now. For many, they view the relationship with their surgeon and surgery center as a lifelong one, and they may come to you for support in other areas. And finally, don't judge. This gets back to some of our biggest fears. Being judged is what kept many of us away from doctors, gyms, social situations, and more. None of the rest will matter if we feel judged. I'm not saying we shouldn't be held accountable for our own missteps. I'm not asking you to have all the answers, but I'm coming to you to give me support, advice, and options. It can be, in fact, it has to be done in a way that's not judgmental. If it isn't, you'll lose me. I've met so many people in the field of obesity treatment over this last decade, and time again, they've been people that really, truly, deeply care about their patients. So in a way, I hope none of what I've said here is anything new to you, that hopefully this just reinforces what you're already doing. Thank you, and thank you for letting me be here today.